Good morning. I am Judy Van Zant. I am an assistant professor of nursing at Samford University, and I'm here today to talk to you about infection prevention issues in behavioral health settings. Now, why do we need to know about infection prevention? There's three very important reasons that I'm going to point out that we do this training. Number one is it's required by the government. OSHA is the agency, and they require all healthcare workers in hospital settings and community settings to be trained in their guidelines. Another big resource that requires this is the CDC, Center for Disease Control recommendations. And third, but most importantly for all of y'all hearing this video, is for your own protection as a healthcare worker. Now, there's two major areas of concern when we look at issues that have to do with infection. Number one is we're thinking about bloodborne infections. Now, these are pathogens or serious bacteria that can be carried in the bloodstream. For example, you've probably heard about hepatitis B, hepatitis C, and HIV. Which is AIDS, and I know most people have heard of that. These are all carried in the blood. Hepatitis B, you have flu-like symptoms and you have jaundice, which causes your skin to turn yellow. The very great thing about hepatitis B, if someone does contact that, is we do have a vaccine to prevent this. So for healthcare workers, this is very important because we have a vaccine if a person is exposed to prevent this. Hepatitis C is a very serious liver disease with many symptoms similar to hepatitis B, but we don't have a vaccine for that. And then, of course, we all know about HIV. It's extremely serious, although in the last few years they have much better treatment. People are living a lot longer, but none of us, want anyone to get that disease. Another thing that we're concerned with in behavioral health settings is TB. Now, other reasons that we need to be concerned is we need to look at the high-risk populations that we come in contact with. For example, we may come in contact with IV drug users or people who are in recovery that have used drugs. Also, we can come in contact with people that have sexually transmitted diseases. Another thing that we could come in contact with is we may have clients with behavioral issues that have self-mutilation. Another thing may be our populations are homeless. And then a fifth category is we do have some of our clients with behavioral health problems who have a thing called impulsivity, where they don't have the judgment maybe that you and I would have. Now let's look at two classifications of these serious pathogens that are carried in the blood and can affect healthcare workers. First of all, we need to look at where these bacteria could be carried. So we'll look at contact between healthcare worker and the person that may unknowingly have this. First of all, the areas that they're carried in are blood, semen, and bodily fluids and amniotic fluid. So the mode is actually the way it's transmitted. And so we have to look at areas like exposure to blood, sexual contact, and perinatal, those people who would take care of mothers who are breastfeeding or who have just had babies or who are pregnant. Very, very high risk that we have to look at and think about, because this is how these bloodborne pathogens are carried, are anybody that's presently has IV drug use, anybody having hemodialysis, and then again, I'll point this out again, as a healthcare worker, you are at highest risk for these bloodborne pathogens. Sexual contact and multiple partners. We also have to look at breastfed babies of mothers who are infected with those three pathogens. Now, how do we prevent this? There's a thing called standard precautions that is utilized by all healthcare workers. It's taught in all nursing, medical schools, programs for patient care technicians, and it's called standard precautions. So I'm going to outline for you what is under that. In hospital, we must be very safe with the needles that are used for injections or IV use. So safety needles are used, and everybody's trained properly on disposal. and this applies to community agencies too that would be giving injections, like the health department, like the Center for Psychiatric Medicine's outpatient program, I think, where they give medication to mental health consumers. Another thing that's part of standard precautions that's very important and may not apply directly to the mental health care workers, but it's still very, very important and needs to be remembered. If anybody may be in contact with blood, for example, there could be some type of splashing to non-intact skin. Part of the standard precautions are to wear gloves, gowns, masks, and goggles. So I think the major concern probably for people in the community would be you must wear a barrier when doing mouth-to-mouth resuscitation, because all healthcare workers are trained in CPR, and it's very important that we do have mouth barriers or pieces that we use when we have to do mouth-to-mouth with the clients. Another thing to think about in terms of prevention is to teach all consumers to avoid high-risk behaviors. So consumers of mental health care out in the community need to be taught to avoid these high-risk behaviors. Another thing to consider in terms of prevention is if a healthcare worker has an occupational exposure, for example, they gave a shot and the needle accidentally touched them or punctured their skin, they would need to definitely follow the protocol guidelines written by their agency, which generally they have to fill out a report, they have to see a medical professional, and have post-exposure testing. I can give you a little story to show you that I'm still alive after the 1980s when I was working as a nurse and I accidentally came in contact with an IV needle and I was punctured. I was very, very fortunate and followed up, and I've got all the testing that I needed to get. I got immunization for Hep B, and this has been 20 years later. I'm healthy, and everything was fine. But the important thing was I reported it immediately. I filled out all the proper protocol and paperwork. I got tested. I got immunized. So it's very, very important to take advantage of that. So strongly consider taking the Hep B vaccination if you're working in an area of high risk. And so that, to me, that would be people doing wound care and people working in hospitals or people working with blood. Or if anybody's had hepatitis, it's probably not a bad idea to get that Hep B vaccination. Other concerns for healthcare workers. We live in an era of multi-drug resistant organisms. Now, what does this mean? This means that we've had overuse of antibiotics, and we have what is called superbugs. So we have some bacteria that are extremely resistant to antibiotics. There's one called methicillin resistant Staph aureus. It is a Staph aureus, which is one of the most dangerous organisms that can grow in a human being. And this particular strain is resistant to almost all antibiotics. So it's become a big problem in healthcare that we need to be aware of. There's another one called vancomycin-resistant enterococcus that's another example. And then there are getting to be organisms that are penicillin resistant. We need to talk a little bit about the concept of colonization versus infection. Back in the older days, you might have heard the term carrier. What happens with colonization is an organism can present itself in the body of a person. And in most people, that would cause you to become ill. In some people, it does not cause them to be ill. It just means it's present in their body, but not causing them any kind of illness. The problem with that is they could be a carrier to another person that could be susceptible and get this organism. We have to talk about this in the community because this MRSA organism there have been outbreaks of this. Daycare centers, correctional facilities, the military, athletics. So it has now reached the community from the hospital. So it's very, very important that we're aware of this. Recommendations for those with multi-drug resistant colonizations, those are those people that are carriers, and hopefully we will have that information with our populations. Most of the guidelines say that you do not restrict these consumers from social activities unless you have proved documentation of transmission. But we all need to be very surveillant, and we need to remember there are resistant pathogens, and we need to use our standard precautions whenever necessary or indicated. Now, another pathogen that's of much concern to us in the healthcare community is TB. Although TB has been eradicated for years and we do have good medication for it, we still have populations of people who get TB. The thing about TB is that it's transmitted by droplet. So what that means is coughing, sneezing, or even speaking, the organism can be transmitted. Another thing that's very of much concern is it stays in the air for a long period of time. Signs and symptoms that your consumer might have is anybody having night sweats, fatigue, fever, chills, weight loss, or if they've been coughing for 3 weeks and have no appetite. It should be suspicious if they're in these high-risk groups that were mentioned before to send them to their healthcare provider. Now, OSHA requires blood tests for all healthcare workers annually, and this is the TB test. So the TB skin test is required for all healthcare workers, inpatient and community. Basically what this procedure is they take a little bit of that tuberculin virus or organism and they subcutaneously inject that. You go back in 2 days and have it read. Now, generally, there's no reaction to it. Every once in a while, somebody will get a red spot, and if you ever have that, your providers will tell you to come back in. It may be that you were exposed to TB virus, but you don't have it. Or it may be they need to follow up with you with a chest x-ray. But it's very, very important, and it is required yearly to have that TB skin test. I myself take it every year. So I know, I'm very familiar with the test. Again, remember that TB is a highly, highly infectious organism. Now, the next classification that we need to be concerned with is sexually transmitted diseases, and it's really not a problem for a community health care worker because you don't get it through routine contact. As we said before, you would get it through sexual contact. So again, just remind to use standard precautions. Although we do need to teach all of our healthcare consumers in the behavioral health settings we need to teach safe sex practices, and we need to teach them and educate them about STDs. So let's sum up again standard precautions, and let's go into another area that has not been mentioned, that this is how we want to present it to you. Use this with patients all of the time, what I'm going to talk about next. And this is hand hygiene. Very, very important. Hand hygiene is important. Personal protective equipment, and that would be the goggles and masks and gowns if you're in that situation. Most likely that would be in a outpatient medical clinic, or it would be in hospital. We have to look at equipment and surfaces, though, so we need disinfectants for that. With hand hygiene, we're mentioning 2 things. You can use alcohol-based hand sanitizers, and I know at Piper West and Piper McCoy we have the hand sanitizers on every table, so all the consumers have access to that. Hand washing is very important, especially if people's hands are visibly soiled. And when we say hand washing, we mean at least 15 to 20 seconds. We need people to use warm water. We need them to clean under their nails. We need them to use paper towel to turn off the faucets. And I have a picture in a book that we'll probably put in the slide presentation to show you more about that. Very, very important to remember. You must do this hand hygiene, and hand washing is critical before you eat and after you use the toilet. Gloves should be used if there is anybody that you come in contact with that has a scrape, that has a wound. Even a little nick where there has been blood involved, you must wear gloves to handle that situation with that consumer. Eye goggles I already mentioned. I don't think there'll be much use for that, but if there could be any splashing of anything, a person would need that. And then, of course, they would need the gowns, gloves, and mask if they were doing wound care. Another area that we need to look at under prevention measures is respiratory hygiene. Now, this is cough etiquette, and it's suggested that posters are put in all areas where you have your consumers coming. You really need to remind them with these posters. With cough etiquette, what we're basically talking about, and our consumers have had a lot of education on this, and our staff has, but when you cough, you need to cover your nose or mouth with the Kleenex. If you don't have a Kleenex, you can use your sleeve. We need to have tissues available, and we need to have receptacles for our consumers. And then, of course, if you handle any of where anybody has had secretions, if you handle that, like if it's on a table or it's gotten on you, you need to immediately go wash your hands at that point. And last but not least, in terms of hygiene, for respiratory hygiene, if anybody has a cold, a sinus infection, and they're having a cough, you need to place people 3 feet away from one another. So we don't think about isolating people, but we need to kind of put some space between them and other consumers. And then I had mentioned hand sanitizers and receptacles for the tissue in all the areas where the consumers are going to be gathering. And then you can offer a mask to one of the consumers that might be coughing. So this ends my presentation for this morning, and hopefully it will be very helpful to you in your career. Thank you.